Hello, I'm John North. I'm 59 years old and I have breast cancer.
I'm Dr Sachedina from We Mentor You. Every year, approximately 2,800 men are diagnosed with breast cancer. Today, I'd like to introduce you to a patient of mine. His name is John North. We're going to create Team John North. John has just been diagnosed with breast cancer. We're going to take him through this journey as a collective group. Positive thoughts, positive outcome, yeah? So today what we're gonna do is we're just gonna talk about your journey. Your surgery is scheduled for Friday, right? How are you doing?
Nervous, worried, optimistic, anxiety, and feel great about it, all rolled into one.
That, you know what? If you weren't nervous, we'd all worry about you. So that's all normal, right? Let's go through a little bit about your life these last few months. Let's go back to March, for example. Something life-altering happened. So would you mind sharing?
No, my wife, Claire, 28 years we were married, she passed away March 9th.
I'm sorry.
She's been sick for a long time. She had a lot of difficult health conditions over the years. Liver transplant in 1999, liver and kidney transplant in 2010.
So you've been dealing with medical issues for a long time in your home, your household.
Supporting her, yes. I was always the healthy one, and she, was a fighter, and we have a 21-year-old daughter,
Yes.
Caitlin.
Tell us about her.
Caitlin is she's 21. She is on the autism spectrum. She's very high functioning. She's a student at Seminole State College right now.
Good for her.
Yeah, she graduated Oviedo High School and with a lot of help from her mom, and she's on a path to a physical therapy assisted program at Seminole State. So she's doing great, and
So you've had all of these personal challenges, right? So go back to now what happened when you went in for your physical. And this is a man who basically has so much on his plate, yet you managed to get in for your physical exam. You were not having any symptoms. And when you came in, you had no family history of breast cancer. You did not meet any of the sort of high risk things that we discuss in male breast cancer patients, right? So let's talk about, you made your physical exam appointment, you went in, take it from there.
Dr. Moldavano, my primary care, it was just a routine physical, and she noticed an abnormality with my left breast. She noticed the nipple kind of retracted inwards.
And actually it was a subtle finding because it was not a drastic nipple inversion. It was basically just a subtle little change. And my hat's off to her because after that, she then sent you for a mammogram.
Which she did. She said to me in clinic that day, she said, "How long has it been that way?" And I said, "I didn't know it was."
Exactly.
I had not noticed. So it was.
So what are you thinking at that point? You're like, yeah, my nipple's maybe a little flat. She wants me to get a mammogram. But what were you thinking at that time?
I was thinking, this is nothing. I mean, she's what? And it was amusing in the clinic setting that day. I felt like I was back in the Navy being inspected. She was.
You're in the military?
I was.
Thank you for your service.
Thank you. I felt like I was in an inspection. She was looking at me and kind of almost pacing in the exam room, and you could just see the wheels turning in her head. And she finally, after pausing for a moment, she said, "Well, you're going to get to experience a mammogram." And I thought, really? So, okay.
Had you ever heard of a male having a mammogram up to that point?
No, I read somewhere years ago that I think in a magazine article that, hey, men can get breast cancer, but as far as, no, I had no idea.
So you go on and you get your mammogram.
I did. I made the earliest appointment I could and went in for the mammogram, and which was a bit humiliating, but I mean, Simon Med, they were nice about it and helped me get through it. And they explained to me, look, we'll do the mammogram, and if anything is alarming, then I don't think that was the word. If anything is suspicious, we'll move straight to an ultrasound. And we did. And the ultrasound tech, she said that, we'll just wait after she did the ultrasound, and the radiologist would have a look, and then she would tell me what the finding was.
So then, did the radiologist tell you, or did your primary care tell you?
The radiologist came back to the waiting room and said, hey, I need you to come back after a pretty long wait, actually, about 30 minutes. She said, I need you to come back into the room. The doctor, the radiologist, wants to talk to you. And I thought, well, that can't be good. So, sure enough, he was in another building somewhere, and so he called, we talked on the phone, and he said it looked suspicious, and he wanted me to go for a biopsy, and they were referring back to the primary care doctor, and I got on the phone as soon as I got home with Dr. Moldovano's office, and I guess their expectation was that she would order this biopsy with them. She referred me to you instead,
Right.
Which I'm very thankful for. And
here we are. So when you came in, I remember that we had this conversation. That was the first time that we ever met. And believe me, I have a very healthy respect for those conversations like the one I had for you. And that is that life, it changes on a dime, right? So I remember when I showed you everything and I examined you and I did my own ultrasound and I was showing you, remember all of the features of a cancer. And then I explained to you what the pathway is going to be, and that we would proceed on to biopsy and move forward and so on. I remember the look on your face like you've just been gut punched, and that's normal. That's how, I have a healthy respect for that. I know what that feels like, and that's before I knew anything about what was going on in your personal life. But you've handled it so well. And then we had this whole conversation about trying to educate others, right? And mentor others through this journey that you're taking. And you were like, yeah, I want to do this. And even somebody asked for prayers for you, and they weren't going to discuss your name. And what did you say?
I said I'd like to share the information with others, and particularly men, and try to help others realize that this is something we need to pay attention to.
Right. Because education, when it's shared, it empowers everyone, doesn't it? So surgery's coming up on Friday. I'll see you then. Okay. And we're asking for people to join Team John North with prayers and good vibes, right? B&J.
Yes.
See you soon.